Hi, everybody. It's me again, and it's time for another COVID-19 update. So let me go ahead and start sharing my screen with you so you can see my slides. So the global decrease in cases continues, thankfully, and we are decreasing finally off our peak here in the United States and in California. But unfortunately, mortality does appear to still be rising because there's always a lag behind cases and hospitalizations when that happens. To start with vaccination, you can see that unfortunately the US has continued to drop as far as the share of our population vaccinated against COVID-19. And we are now really at the bottom of the list of all Western democracies as far as how much we have vaccinated. You can see all these countries above us in the 60 to 70% range, and we're really down in the low 50% range still. You can see that we do have over 180 million people vaccinated, which is great. And now we actually have over 2 million people getting a booster dose since mid-August. When you look at the age breakdown, you can see over the age of 65, we're doing quite well, but under that age group, we are not doing as well. When you look at the doses per day, you can see the curve slowly, gradually shifted up during the main Delta variant surge, when I think most people were becoming concerned and going to get vaccinated. But unfortunately now it has stabilized down to a lower rate. And of course, that brings me to this projection page where a month ago, I excitedly told you that by March of next year, we would have 90% of our population vaccinated. But unfortunately, due to this shift in dosing rate, we're now pushed out again until June of next year. And it is the same spots that are lagging in vaccination rate that we have seen over and over. But the overall percentage is shifting. If you look at this bar at the top, 2 weeks ago, that was in the 40 to 50% range, and now it's in the 50 to 70% range. So overall, as a nation, we are slowly getting more people vaccinated. Here in California, you can see the same kind of stabilization of that curve where we had a little bit of a higher rate uptick, and now we're down a little bit again. When you look at this breakdown by age group, you can see that California is actually doing a little better overall than the overall US when we talk about vaccination, but in that age group over 65, there's a lot of hesitancy still, and we are doing much worse than the overall US population in that age group. Here in Santa Clara County, thankfully, we are doing excellently. We have over 84% of our population over 16, and actually even 83% of our population over age 12. So there is a lot of embracing of the vaccine here. And this actually still pertains to the age group over 65 here in Santa Clara County, which is wonderful. We are much more on par with the overall US compared to the rest of the state of California. If you look at global cases, we are now reaching 230 million. Thankfully, still fatality rates remain low because we know much better how to treat this disease and save people once they become hospitalized. You can see this nice downturn of the curve. There's a 12% drop over the last 2 weeks, and this is on top of the 11% drop we saw the 2 weeks before. So this is great. And when you look at hotspots, you can see that the US and the UK used to be that very dark, almost black red, and now they're lightening up a bit. Unfortunately, Brazil has had an uptick again. And when you think about these peaks and valleys of the surges, we do tend to see a start in the Southern Hemisphere before it cycles to us about 2 to 3 months later. So this is definitely something to watch. When you look at the other countries that are interesting to look at compared to our case rates, again, a lot of the story of this slide has to do with vaccination and where we compare to others. However, there is something more to be looked at here because, for example, Israel, as we know, has a very high vaccination rate, and yet they've had these jagged peaks, and their case rate is still well above where we are and where Chile is, which has a similar vaccination rate. And so there's something more to be learned about how the cases are spreading there. When you look nationally, you can see that we do have a descent from this sort of jagged peak at the very end of this graph. When there's such high variability like this, it's hard to predict whether we are going to continue to go down or we might spike again before the complete downturn. So we'll have to watch that and hope for the best. And when you can see these hotspots across the US, again, you know, when I first started showing you these maps. Missouri and Arkansas were the hotspots where the Delta surge started here in the US. Now they have primarily cleared, and you can see this spread out into Texas, Appalachia, the rest of the Southeast, and the Northwest, West, Alaska, even Maine. And this is mirrored in this state by state breakdown where you can see, thankfully, almost all states are decreasing off their peak. Some are still rising. And interestingly, Vermont, Delaware, Maine, these areas in the Northeast that were largely protected because of their very high vaccination rate and good masking and distancing policies now are seeing a slight peak. And this really shows that although you can do really well in your own state, we cannot hope to remain completely isolated from the rest of the United States. And whatever starts in any other state will eventually find us. So when you look at California, you can see that we also appear to have hit our peak in this surge a few weeks back, and now are coming down and stabilizing. Same with Santa Clara County, and same with San Mateo County. When you look at Stanford, this was updated about a week ago, and so it's not completely up to date, but you can see there was a little bit of an uptick as school started, but overall we're controlling this quite well, still only a 0.22% positivity rate compared to the 1.8 positivity rate in Santa Clara and the 4% positivity rate in all over California. This similarly holds true for the faculty, postdocs, and staff here, where we've been only having 5 last week, 45 the last month, and an overall low positivity rate. The story remains the same when we talk about variants. Delta is still over 99% of all US cases. Here in California, you can see that Delta variants, and Gamma really are almost completely the entire story, 0.2% of Alpha, and everything else much lower. The variants of concern remain the same. Last 2 weeks ago, I talked to you about Mu becoming a new variant of interest, but still Lambda and Mu have not outperformed Delta, and so currently are not anything that we need to worry about, simply ones that we need to keep an eye on. There are a couple of new variants that are creating some chatter in the media, so I'll just tell you about them briefly. R.1 is a variant that created 45 cases in a Kentucky nursing home, and so not just there, but in other parts of the US, it has arisen, and it's one to watch. You can see that it does have this triad of the mutations, which is a similar triad that all the other variants of interest and concern currently have. And so it has simply mutated from one of those, most likely. And then it has some additional mutations that may make it less susceptible to vaccination or less susceptible to antibodies. And so we'll have to watch how this one acts. And then there's a little chatter in the social media about A.23.1 and A.30 also, which are two variants that have arisen in Africa, which actually do not have the triad, those common 3 mutations that all of the other variants so far have. And that means that they are independent descendants from the original Wuhan virus. And, we don't know yet what that means. Do we know if that is going to change how the vaccines affect these or how antibodies affect these? We don't currently know, but because they do not have the similar mutations as the other ones that we know so far, it is, again, just something to watch and keep an eye on. When you look here in Santa Clara County, again, Delta and Delta Plus variants, almost all of the cases that we see here. There are 5 Lambda variant cases, but no new cases in the last month. And then there are 36 Mu variant cases. In pediatrics, as I told you 2 weeks ago, there has been a significant rise overall in the US. They now represent almost 26% of all COVID-19 cases in the last couple weeks. And before that, there were only about 15% of overall cases, a definite increase. But thankfully, the overall percentage of hospitalizations and mortality from this rise still remains very, very low. And so hopefully this means that our children remain overall better protected. When you look at why there's been this huge increase, you can see that in a place like Mississippi, where there are very low vaccination rates and there's a lot of battle over policy concerning mask mandates and distancing, things like that, you can see this very obvious rise in the pediatric cases from very, very low in March to very high this summer. However, I want to juxtapose that with the cases seen in a place like San Francisco, where we have a very high vaccination rate in the adult population, very high adherence to masking and distancing protocols. And you can see that although we've had a slight uptick in the pediatric case rates, it is nowhere near what we've seen in other parts of the country where ICUs and hospital beds are overflowing with children. And you can see that even in spite of the school reopening, because we're using policies such as what I just mentioned, we have been able to stay safe through that opening. When you look at hospitalizations, you can see that there has been a descent from our peak a couple weeks back. And then in California, the same holds true, this descent off of our peak. And then in Santa Clara, also decreasing. In San Mateo, also decreasing, which is great. In San Francisco, we're also decreasing significantly. And in the Bay Area, we are also decreasing. When we talk about mortality, this always lags behind case rates and hospitalization rates. And so we are still rising overall in the US. As many of you may have heard, 2 days ago, we reached the point and surpassed the point of how many deaths were seen during the 1918 flu pandemic in the United States. Some people thought we would never get to that point, but here we are. And part of the reason for that is when you look at the United States compared to these other countries, compared to these other Western democracies, which have very high level healthcare systems, high technology, high infrastructure, such as the UK and France and Germany and Canada. But then also when you compare to India, right? We have a higher number of deaths than any other first world Western democracy, but we also have a higher number of deaths than a third world country with over 1 billion people with much less healthcare technology, capability, infrastructure. And this really reflects our will as a people to fight this virus, do the things that we know can help, such as vaccination and masking. And this is really, the onus is on us to bring the death rate down. When you look at California, there is still a rise. Hopefully we'll see this stabilizing soon. And in Santa Clara, there have been 32 deaths over the last 2 weeks. Hopefully we'll also see this stabilizing soon. So on that note, I will stop sharing and leave you with that. I hope that this more global and national overview of the data gives you a little bit of insight into what we can do to try to bring this entire pandemic to a close. And I will see you again in 2 weeks. Bye-bye.